Good morning. I want to thank everybody who joins us. My name is Olha Atamanova, and it's my pleasure to welcome you at Ukraine Media Center today. Today, we will be talking about an important topic. We will be talking about the changes to take place in the national vaccination calendar. The changes are planned to happen starting from the year 2026. And joining us in a studio to discuss it are Ihor Kuzin, Deputy Minister of Health, Chief State Sanitary Doctor of Ukraine. Also joining us is Fedir Lapii, Head of the National Technical Group on Experts in Immunization, and Veronika, Patsko, Clinical Oncology Specialist of the National Cancer Institute. Thank you for joining us. We know that basically the changes that are going on in the calendar is a stale practice. It happens in all of the countries all around the world. So today, there are still public discussions going on about the changes to take place on our end. Let's discuss them in detail. So, Mr. Ihor, so what are the news? What are the updates that are planned to take place? Thank you very much, dear colleagues. Let me start with the national vaccination calendar. Is the order of the Ministry of Health of Ukraine that covers the interests of all of the Ukrainians, because it regulates the list of mandatory recommended vaccinations. It prescribes the vaccination schemes by age, and it's a valuable document for every medic to keep track, to be able to keep track of the adherence to the calendar, adherence to the schedule. That's why upgrade of the calendar is a normal process. It's normal in terms of adaptation of the legislation of Ukraine to the best global practices, to the legislation of European Union, to take into account the specifics of this or those infectious diseases, or the newly updated recommendations of the global specialists. That's why the task team has proposed the changes that were made public by the Ministry of Health of Ukraine for the public discussion. And the recommendations contemplate all of the changes recommended for the upgrade of the calendar. Well, it's a pretty significant update, and the changes are proposed to take effect on the 1st of January 2026. As you know, vaccines are not being procured like on the very next day. It contemplates a significant vaccination schedule, procurement schedule, and even after the initiation of procurement, it may take up to 9 months for a vaccine to arrive at Ukraine. And in order to plan the schedule, in order to ensure the transitional period for the doctors with all the necessary training, we initiate such changes with the beginning of this year to ensure as much time as possible to implement the newly updated vaccination calendar. Talking about the phase of development of this order, there is a procedure for public discussion which is set forth on a legislation level, when all of the specialists can provide their proposals for the update. All of those proposals will be reviewed. If they are reasonable, they will be taken into account in the final version. It's an important thing that can influence this or those changes. The proposals will be accepted within 1 month, and by the end of the month of January, the order was made public in the beginning of the January, so the proposals will be accepted until the end of the January. Talking about the details, my colleagues will focus on the details probably. But what I would like to announce is that one of the key changes is the implementation of the new antigen, the vaccine against human papillomavirus. In my opinion, it's a breakthrough for Ukraine, because we were using this vaccine on a commercial basis And in very rare cases, we were getting it as a humanitarian aid, but there is a huge demand for this vaccine. It allows protecting children and adults in perspective against those types of cancer that are caused by oncogenic types of virus. And implementation of this vaccine will significantly influence the contagion level, the level of cervical cancer, which is a significant problem for Ukraine. Also, multi-component vaccines are planned to be implemented on a wider scale. It's when we use a number of antigens during one injection. It's done to facilitate the process of vaccination, to reduce the load on the healthcare system, and it may only take 1 minute or one visit for a child, for example. There are new vaccination schemes against MMP, B-type hepatitis, etc. And also it was proposed to update the section that was current vaccination in special conditions. I mean, it's when we talk about the people with compromised immunity or other special conditions. So this is the basic changes that are proposed to be added to the new vaccination schedule. Well, to what extent is our country ready to this? What are the sources of funding of those changes? Well, basically, as we look at the new draft calendar, definitely implementation of this calendar will require more extensive funding than we have, because multi-component vaccines are a little bit more expensive, and rejection of oral poliomyelitis vaccine is also making this program a little bit more expensive. Currently, we have the funds allocated from the state budget for procurement of such vaccines at the national level. Also, there is additional funding for the year 2025 for procurement of vaccines against human papillomavirus. That's a separate category. We have this opportunity already. And also, I wanted to mention that in the year 2025, we have a unique opportunity to use the humanitarian aid that was provided to us by the International Vaccination Alliance, Gavi. It's an international alliance that, after the government submits its application, it guaranteed and it continues supplying the humanitarian vaccines to us within the year 2025. So basically, the vaccines will be provided to us on a humanitarian basis. It will allow us to reconsider and optimize the budget to ensure new procurements in the year 2025, to make sure that in the year 2026 we fit within our budget, the vaccines are in the country, and we get back to the government procurement at the expense of the government budget. Thank you very much, Mr. Fedir. Let me ask you, so when it comes to the vaccination against contagious diseases, what changes are about to take place and why are they urgent? Well, one of the tasks that the national expert team is facing is to inform the Ministry of Health about the current updates happening and news in the world, and we were making it not depending on the session. And when it comes to the implementation of the new vaccines or optimization of the calendars in terms of rationality and efficiency, it's yet another responsibility of the task team from the scientific perspective. When we talk about vaccination calendar, it also includes a financial component. There is a definition of value that cannot be measured in financial terms, because when it comes to cervical cancer, when it comes to life or death, we're talking about value. And we have to say that, yes, it may cause some budget expenses, but we're saving lives and it generates value in that way. This is what we're guided by. the prevention program is also the adherence of the population to the vaccination calendar. When and how can we use the available resources when people come for vaccination? And it depends on the situation. When we talk about the change of the age or the vaccination schemes, we were recommending to start the vaccination with BCG after 24 hours. The current schedule contemplates the 48 hours time. First of all, the vaccine can be injected within the first hours of life, but we don't have this tradition. Meanwhile, it's a normal practice all around the world, but we were also orienting at lower birth rate. We were trying to vaccinate children back at the maternity homes because we were trying to prevent any bacterial infections there that would be resistant to the vaccine. So the longer you're spent in the hospital, the lower the chance you get out of there without complications. I mean, the immunological complications. And thus, we would like to have children protected as soon as they sign out of the maternity homes. Talking about the MMP infections, poliomyelitis, when we vaccinate children at 2, 6, 12, and 18-month age, it allows us to expand the range of vaccines that we are able to procure because the market is real extensive. We get new opportunities to procure the polyvalent vaccines for the Ukrainians. Then the rate of purchases is growing as well as in Europe, but we have different causes of it. We have a lower rate of coverage of children, and the difficult cases of pertussis are the children, mostly unvaccinated children below 1 year of age. So we have to vaccinate them to prevent the growth of the contagion rate. The analysis that was published recently in France says that the cause of the growth or rate of pertussis in European Union is the switch to 2 doses vaccination. Well, it's a difficult scheme, but the Europeans think that those schemes that are being discussed in Ukraine from time to time, they were recommended by the professional communities. And the question was, why doesn't it happen just like in the Scandinavian countries or other countries? And now we have a proof, though those proofs are weaker. Additional doses of vaccine are required, which entail additional financial losses. So why not using something that has already proved its efficiency and safety? We evaluate both financial efficiency and the health efficiency. And when it comes to MMP vaccines, according to the current calendar, the vaccination is prescribed at 6 years. We moved it to 4 years of age. It's like in many countries, they have an interval for second injection between 4 and 6 years. And in Germany, they make the second injection on the second month after the first vaccination in the age of about 2 years. And now a lot of Ukrainians who stay in Germany are being vaccinated under this scheme. Also, we moved the measles vaccination to another age, down to 3 years of age. And we have to think how to ensure the bigger number of doses for more cohorts of population, because the children of 5-year age will get another dose at 6 years, and those who get the first dose at 3 years will get another dose at 4 years. And this is how we solve the matter of control of measles in Ukraine, keeping it under control. And using the 2-dose vaccination scheme against human papillomavirus, well, there is a statement made by the WHO back in 2022. As a member of European Consultancy Group of Monoprophylaxis, well, I can be mistaken talking about the year, but still, many countries have switched to 2-dose scheme, like, for example, Great Britain, Australia, and I can count on. Well, so they switched to 1 dose because there are convincing arguments that prove that 1 dose doesn't work worse than 2 doses. So why 12 or 13 years of age? The vaccine is allowed started from the age of 9 years, and sometimes we are being asked why not earlier. Because when the expert team reviews the requirements, we also review the preparedness of the healthcare sector. We can talk to the adolescents, to the teenagers directly. And for example, I have a daughter myself. She's vaccinated against human papillomavirus. At their age, they are already curious about their health. We have to prepare them to the adult life. We know when the sexual life starts in Ukraine, and it should be happening before the teenagers start their sexual life, before any potential pregnancy and other things we would like to avoid the teenage, before the end of childhood, so to say. If we move it to 10 years as it's recommended, we would have lost a number of age groups because they are about to grow up, they are about to start their sexual lives. So those at the age of 12 to 13 in a year or 2 or maybe 5 years may contract the virus and be added to the cohort of those who may potentially have cervical cancer or other diseases related to human papillomavirus. So in order not to lose it, in order to make sure that the vaccination programs continues working on a stable basis, well, we have to do more awareness campaigns. You know, when children start talking about different potential infections at the age of 10 years, you know, their parents may still neglect it, but we want to make sure that the vaccination calendar is optimal, rational, efficient, and it produces significant effects when it comes to prevention of contagious diseases. Mr. Ihor has mentioned about the combination vaccines. He said we're moving in that direction, so let's discuss their efficiency. We understand that it really reduces the number of injections directly, which is a huge plus for the children, given all of the negative effects produced on the children by that procedure. So, but when it comes to the efficiency, we keep hearing things about that among average Ukrainians. Well, if you ask me whether I like injections, no. Am I vaccinated? Yes. Am I pleased to be injected? No, I don't like to be injected, and I guess children don't like it either. When the parents choose, they want their children to be protected. But mothers and fathers, they suffer when their children feel pain. So the reduction of number of injections definitely makes the parents potentially more prone to vaccination of their children. Well, and when it comes to the combined vaccines, we use them. We have been using them long ago. For example, MMP vaccine. But the whole different thing is like we started adding more components. For example, hepatitis B vaccine, inactive poliomyelitis vaccine, and the global experience of the use of those vaccines, well, it's extensive. Ukraine has that experience too. We had it during different periods. For example, now we use pentavalent vaccine against 5 contagious diseases. Well, if we consider the experience of other countries who have good systems of epidemiological surveillance, well, first, they are safe, and B, they work, and we take into account many nuances to make sure it's efficient, and we recommend, for example, 3 doses against pertussis during the first stages of life, not 2 doses, and not to switch to the cellular component because it's way more expensive and less efficient in terms of control of difficult cases of pertussis in Ukraine. So we are guided by the sentiment of efficiency and safety both. Thank you very much, Ms. Veronika. I guess the key part of this vaccination calendar is the vaccination against human papillomavirus. Is a story that is being spread all across Ukraine. So let's discuss it in more detail. So to what extent is it efficient? To what extent do we understand that it's an efficient protection against cervical cancer? Well, for the time being, there is such a statistics that 90% of all of the cervical cancer cases are related to human papillomavirus. And let's not forget that on top of the cervical cancer, there are other infections related to the other diseases related to this infection. And more than 3,000 women a year are diagnosed with this disease in Ukraine. And only 30% of cases account for medium stage. Meanwhile, the rest accounts for the later stages of disease. And when it comes to the vaccination in other European countries, the rate of papillomavirus-related diseases like pre-cancer conditions or such conditions as papillomatosis, which is a threat to life, it was reduced significantly, and respectively the mortality rate was reduced. We have good examples of millions of people which demonstrate that this type of vaccination is an efficient method for prevention of this type of disease. Well, for what we know currently, this vaccine is coming on a paid basis. So what are the changes suggested by the National Vaccination Calendar? Well, currently, at the year 2024, there were 2 vaccines available, 2-valent and 4-valent vaccine. And last year, 9-valent vaccine was registered. Well, what does it mean? How to explain those? How can I explain those words? There are more than 200 types of human papillomavirus, and there are such that are called high type or oncogenic viruses. Fortunately, not all of them are very aggressive, only 16 to 18 of them, those that are related to the cervical cancer. And 2-valent vaccine protects against those 2 types, 4-valent against 2 more types, and 9-valent against 9 types of human papillomavirus, which allows to ensure protection not only against those viruses that are causing cervical cancer, but also those that cause the cancer of mouth cavity or acute condylomas. It basically allows us to expand the range of diseases that can be prevented by the type of vaccination. Yeah, let me add, if I'm allowed, first of all, we're talking about the availability of vaccine in the market here, and you can get vaccinated, which is not so cheap, unfortunately. We cannot guarantee everything on the part of the government, but still what's worth mentioning is that the law doesn't prohibit, and we have a lot of cases at the level of the communities when they adopted the cervical cancer prevention programs in the communities. And let's recall the programs that are working in Kyiv or Lviv region or Odessa region or Volyn region. But I would like to say more about the fact that such programs were successfully adopted at the level of even the small communities. For example, there is a Stanishev community in Zhytomyr region that was an initiative of a family doctor to take part in the session of the village council and say that our girls are worth to be protected against cervical cancer, and they got 100% by the community, 100% protection by the community. Well, the same situation was happening in Vyrosh in Odessa region, then in Ukrainian Venice in Odessa region, Vilkovo. Yeah, in the same manner, they've procured the vaccines for all of the girls at the community level, and now they suggest this vaccination for the males too. But those are the exceptions that unfortunately don't cover all of the needs, and we're saying that girls are the priority. Well, we should add men to make it even more efficient. And here the government is supposed to undertake those obligations to prevent cancer. That's one of the prevention methods, to eliminate the cervical cancer and take other diseases under control that are related to human papilloma virus. There are already cases in Ukraine, and we were orienting at them to be able to recommend to have this vaccine included to the national vaccination schedule. Well, when we talk about the calendar, we mean that those vaccines will be coming for free for our population. Am I correct? Yeah, absolutely. The calendar has a dedicated section that means that describes the mandatory vaccinations. Those are the vaccines that are procured at the expense of the government budget. They are procured at the national level, they are distributed throughout the regions, and the key infectious diseases such as pox, parotitis, tuberculosis, poliomyelitis, B-type hepatitis, and vaccination against human papillomavirus is included in the list of the mandatory vaccination. So it will be first mandatory, and secondly, it will be free. It will be procured at the cost of the state budget. So if the program starts working in the year 2026, including human papillomavirus vaccination, what is the age of the girls it will cover? I mean, I'm asking for those who may want to do this vaccination at their own expense. Well, basically, the results of the clinical studies and scientific studies say that the highest percentage of reduction of human papillomavirus associated cancer is observed in the age group of 12 to 13 years, 87% at this age. And if we look at the higher age categories, they account for 60 and 30% respectively. So currently the draft law contemplates the vaccination, or suggests the vaccination of the girls of 12 to 13 years age, so only the teenagers of that age will fall under the vaccination program. Those who will be of different ages, like younger or elder, unfortunately they will not be able to be vaccinated for free at the government expense, but still the vaccine will be available in the pharmacy chains at pay basis. Well, every state identifies what they can cover and how it can be the most efficient, so the maximum results at minimum efforts. So the maximum result can be achieved when we cover the girls of the 12 to 13 years and we clearly identify the age in the vaccination calendar, like 6 years or 6 months or 2 months or 12 months, and we're given this corridor 12 to 13 years because we understand that in many communities both medics and population are ready, but we have to get prepared to implementation to make sure it's efficient, to ensure the communications campaign, the awareness campaign, to ensure proper training, to avoid communications crisis, to avoid any situations that we would not like to be distracted by. But 12 to 13 years is the optimal age. And that said, we've mentioned that vaccine is allowed to be used starting from the age of 9 years, and we're saying that it can be used starting from the age of 9 years, for example, for the girls that were subject to those who survived sexual violence, because such facts can be related to human papillomavirus development. When it comes to the program of oncological diseases, well, there are people, for example, living with the human immunodeficiency virus, and we've contemplated that if it's a child who lives with an HIV, they can be vaccinated starting from the age of 9 years, but we recommend 3 stages of vaccination in those cases. Currently, there are discussions, and thanks to different networks, we keep getting many both practical remarks. I want to thank my colleagues for them. We've announced that there will be a public discussion. Please get involved. Pay attention to all of the details, to all of the misunderstandings. How can we set forth this or that statement better? Refer to the sources, and there is an online group, vaccination questions and answers, in Facebook. It already has more than 136,000 members. There is a dedicated website. There is a notebook for a family doctor. That's a dedicated professional group. We as medics, we organize ourselves for discussion of different cases in different groups. Well, that group, it has 35,000 members. The total number of medics in Ukraine is about 120,000. So 35,000, those are mainly the family doctors who were asking questions during that public discussion, providing suggestions, making remarks. We're saying that probably in this or that case the wording should be adjusted. So we're currently talking about the project in development. There were remarks and suggestions, like there are people of older age, older than 12 or 13. On top of that, there are boys. In the countries of European Union, the human papillomavirus vaccination is gender neutral. They vaccinate boys against that infection. It increases the efficiency because the men can be carriers. They also contract that disease, and vaccinating men, we increase the efficiency of prevention of human papillomavirus, but we make priorities for ourselves. We start with the priority group. We select the priority age category to ensure the maximum efficiency with limited resources. We do a lot of work related to the choice of vaccine, its amount. We are currently in negotiations with the suppliers, and when it comes to the vaccination of people who live with HIV, it's still pressing, and the next meeting of the National Technical Team will consider this matter for the adults as well. Well, we didn't put a period in the and so far, because the work will be going on until the very moment of signing of the document, until it comes into effect in the year 2026, when the new calendar starts working. Well, the work is going on. Thank you. Thank you, Mr. Fedir, I would like to finalize about the human papillomavirus. Ms. Veronika, let me ask you, we understand that the state cannot cover it all and it prioritizes its capabilities, but there are many conscious parents who want to protect their children, their daughters, against such type of disease as cervical cancer. What are your recommendations for those parents whose daughters unfortunately don't fall within that age category, 12 to 13 years? Until which moment is this vaccination efficient? Well, according to the data from the latest studies, it was demonstrated that the vaccine remains efficient, the vaccination remains efficient until the age of 45 years. It's not only girls who can get vaccinated. The view has changed about whether it's worth to get vaccinated after the beginning of sexual life, or, for example, is it worth vaccinating if a woman is vaccinated, has already contracted one of the types of human papillomavirus. So the vaccines were proven to be efficient until the age of 45 years, but before vaccination, when it comes to vaccination of the minors, they should consult with the pediatrician, and when it comes to the women who already lead their sexual lives, they should consult with the gynecologists, because they should be aware of any pre-cancer conditions that may potentially emerge, or emergence of any malign tumors, because in those cases we have to discuss the initiation of anti-tumor treatment. But again, the efficiency of the protection is high. The highest it is in case of vaccination before 14 years for the girls and 15 years for the boys. After the age of 14 years, the efficiency is about 85%, but again, it's recommended. For example, I got vaccinated just a year ago, because before that I was not realizing whether that vaccine would be efficient at my age. Well, let me add that the further we go from the first day of the vaccination of human papillomavirus, the less proofs we have that the vaccines are, or the more proofs we have that the vaccinations are working even after the beginning of the sexual life. Some women can be saved by that vaccination. Some countries have already reviewed and they allowed using that vaccine after the age of 45 years if the women survive the pre-cancer conditions. For example, Turkey, they expand the age categories for vaccination above 45 years when there are already risk factors present. And when it comes to the efficient cervical cancer prevention program, we're saying that vaccination is a primary protection, something that is aimed at the something that is targeting the cause of the disease, because the colleague has touched upon the screening procedures is the secondary prevention that allows to identify the disease and prevent its development, and to provide the medical aid on a timely basis. So those two approaches, vaccination and screening, are currently considered, well, of course, ethics, sexual life, understanding of your partner, and so on and so forth. But those two basic approaches are fundamental to minimize the rate of cervical cancer and other things related to the human papillomavirus. So when we talk about adult women, their visits to gynecologists, they should undergo screening programs. And now the range of the programs is expanded through the family doctors. They may take part in those programs that will ensure wider availability, and the work continues in Ukraine in this area. Thank you very much, dear colleagues. Do we have any questions on the floor? If so, please let us know. You may ask your questions right now. And I would like to finalize our discussion with reminding that the public discussion about the updates to the national vaccination calendar are still going on. So, Mr. Ihor, let's focus everyone's attention. What are the doors that people can knock on with their constructive comments, remarks? The doctors, experts, and just regular Ukrainians. Yes, again, at the website of the Ministry of Health of Ukraine, there is a dedicated section called Public Discussion. The draft order, the draft resolution was already made public there, and there are contacts provided, like email, where you can send your comments or suggestions or remarks. The draft resolution was made public on the 13th of January. We accept all of the comments on our email, and then until the 3rd of February we will be accepting all of the comments and remarks, after which we will start reviewing them. So please send your suggestions to the email indicated in the website of the Ministry of Health. Thank you very much for this conversation. Hopefully it will help someone to save their health, and obviously I would like to thank our security and defense forces, thanks to whom we can gather and hold events like this. Let's continue working together for our victory. Glory to Ukraine. Glory to the heroes.